Ja, dann herzlich willkommen zurück nach der kurzen Pause. Wir machen auch gleich weiter mit dem nächsten Vortrag, der, wie bereits schon angekündigt, sich um das Housing First Modell drehen wird. Und dazu darf ich ganz herzlich Dr. Sam Tsemberis ankündigen vom Department of Psychiatry der Columbia University des Medical Center. Sam Tsemberis gründete im Jahr 1992 das Pathways to Housing.
Good morning, everyone. It's been a very interesting morning. I'm sorry I don't speak German. I would probably fail some of the housing readiness test. Thank you. Although I would demonstrate a willingness to learn German, but I'm not sure I would pass everything on loud and clean. My talk is about homelessness, and this is an area that I have been working in for about 25 years now. And so homelessness has been with us. It started primarily in the United States in the early 80s, but now Canada, Europe, Australia, at least of the Western world. And of course, India, Africa, China don't even begin to measure homelessness because the numbers are quite large and the definition still not debated. But this morning my focus is really to describe the homelessness services and to hopefully point out some things that we have learned in working with people who are homeless that would apply to addressing the current problems that we face with the refugee, asylum-seeking, immigration issues that are all over Europe and certainly North America and Australia and New Zealand as well. So it's quite an important moment in this political, economic challenge that we're all facing. So I'm going to talk about homelessness just in terms of how we have defined it. I'm going to tell you what has been done, what was done not so well, what Housing First has introduced into homelessness that applies to refugee, and I'm going to talk a little bit about some evidence, some empirical evidence about effectiveness, because I think that's an important addition to the debate on the issues. So here's something that I think just important to keep the big picture in mind, that homelessness is not evenly distributed everywhere. It is large or small depending on what country we're looking at, and it's related to something called the Gini coefficient. If you Google Gini coefficient, you will come up with a map like this, which shows you the rate of income disparity between nations, so that for every nation there's a score, like a correlation, that goes from 0 to 1, and the higher your score, the more distance there is between the very wealthy and the very poor people in a country. And so in this map, the color scheme is that the darker the color, the greater the difference between rich and poor, the greater the income disparity. So the light-colored countries, like Scandinavian countries, many of the European countries, Canada to some extent, Australia, less income disparity, and you have fewer people who are homeless in the population. And as the income disparity grows, for example, the United States used to be the same color as Canada before 1980, and in the last 30 years, the United States income disparity has grown by about 15 points, And so the number of people who are homeless in the United States is twice the number that it is in Canada. The other thing about income disparity, it turns out that countries that have the greater income disparity invest less money in the kinds of services that poor people need. Less money in affordable housing, less money in social services. So you have a perfect storm of the income disparity driving more people into poverty and less investment in services for the poor. The way that countries define homelessness varies quite a bit. So this definition is very rough and very global, because to be considered in need of services in Canada or in the United States, for example, the focus is on people who are homeless on the street or in and out of shelters or drop-in centers. And they have to be homeless for quite some time. In Norway, the definition of who is homeless is much broader. It includes people who don't have accommodation to housing. They don't have their own lease, you're considered homeless. If you're living with relatives or friends, you're considered homeless. If you're in an institution, hospital, prison, other institution, and are 2 months away from being discharged and don't have a place to stay, you're considered homeless. So Norway still has a very small number of people who are homeless, but their definition of homelessness is so inclusive, it includes prevention as part of the story. That's very different than having to be 2 years homeless in order to be considered eligible for services. So these policy decisions make a big difference in how you address homelessness and who you consider to be homeless. That's about definition, and I think, to some extent we're struggling here with the definition of who is a refugee, who's an asylum seeker, who's a legal immigrant, illegal immigrant, seasonal worker. So some of these same issues about the definition of eligibility, has some parallels. But most of the time I'm going to talk about this, which is what do we do? What do we do about people who are homeless, and what's the best way to serve them? Well, before we get to what do we do, there is the question of how did they get there? And there's a lot of literature, both in the academic literature and in the public media, about the root causes of homelessness. In the media, the typical story reported about root causes talks about mental illness and addiction. Oh, this person is homeless. Oh, they're mentally ill. They're addicted. Not surprising to see that correlation all the time. And if people believe, public policymakers believe that the addiction or the mental illness drove people to homelessness, then the way to fix it is to fix the mental illness and the addiction so that they will no longer be homeless. That's one approach, which is very widely practiced everywhere. Another approach, some of you are old enough to recognize this guy. I credit, and it's not just me, there was a public broadcasting biography of Ronald Reagan, and he's more in the news today because his wife died last week. But Ronald Reagan is given credit for creating homelessness in the United States. For some of you who remember this, he had supply-side economics. Make the rich richer, and they will help the poor also climb up. All boats will rise. He gave enormous tax breaks to corporations. Corporations are people. Many of the strong capitalist structures that drive, not only the American, but the world economy today came out of his administration. But also out of his administration came a pullback. Government, he said, is not the solution to our problem. Government is the problem. So government was not thought of as a useful way to solve social problems. Beginning in that administration, And in every administration afterwards, after Bush, after Reagan was Bush, and then there was Clinton and Bush again and Obama, the level of investment in the federal government to build affordable housing dropped in 1980. It went from 350,000 units a year to 50,000 units a year, where it has stayed. So there's been, even though there's been different politicians and different political parties, the fundamental structural non-investment at the federal level of building affordable housing continues. And not surprisingly, homelessness, no affordable housing, no affordable rents, the problem of homelessness continues till today. The people who are most frequently homeless are people who have a fixed income, people who have a disability, a physical disability or a psychiatric disability or some other disability, and they're on a government fixed income, which doesn't change very much. The fixed income over the last 15, 20 years has stayed the same. Salaries have stayed the same. Rents have gone way up. So what we see is that the people who are on fixed income, for example, somebody on a psychiatric disability may get something like $670 a month, which is about 90% of the rent. If you end up homeless, out of a hospital, no place to go, with this money you don't have enough for the first month's rent, the security deposit, and you're not going to be presentable to a landlord. So what we see among people who are homeless are many people who have mental illness. But they're not homeless because they have a mental illness. They're homeless because they only get $674 a month, and there's no way for them to get back into housing. That's looking at homelessness from a structural problem rather than an individual problem. But that's not what we've done. We've mostly addressed homelessness as if it's an individual problem, and we have built immediately, starting from 30 years ago, the same industry that's going on right now with the refugee situation that we're talking about. We're addressing the refugee problem as if it's an emergency problem about these people, not a structural problem about the politics of not only this country, but the countries from where the refugees are coming. People are leaving Sudan, or they're leaving Iraq or Syria because of the problems there. People are coming here for sanctuary. We could be fixing refugee issues for years, because unless we stop the flow, address the structural problems, the symptom of people arriving will just go on and on. And it's the same thing with homelessness. Unless we address the economic disparity, the government's investment in affordable housing, easy access to housing, we will be taking care of homeless people for a long time, because we have a social structure that creates homelessness. The structure we have now for fixing homelessness is all about emergency. Somebody's on the street, they're mentally ill, they're addicted, they're physically sick. We have to get them to a safe place, a shelter, get them some food, get them housing ready. Because, somebody who has some psychological problems and some addiction problems cannot manage an apartment. So housing readiness is a big, big part of the industry and still continues today. This is from 2 months ago, Los Angeles, probably the worst place in America to be homeless, because there's 23,000 homeless people in Los Angeles every night in Skid Row, 23,000. And they are not getting off the streets very quickly. So the mayor, after 35 years of homelessness, declared a state of emergency in homelessness. It did bring a few $1 million to more short-term solutions. This is the stairway model, really the way that people have to show that they are housing ready when you're homeless. And it's interesting, the previous speaker talking about sort of the legal and documented housing readiness, because in many ways, the practice of housing readiness is also part of it. Without documents and without checklists, programs require people, spoken or unspoken, there are expectations about how you go from a shelter to transitional housing and what behaviors you have to demonstrate in transitional housing to show that you're ready for permanent housing. So somebody from the street could take as long as anywhere between 2 and 10 years to get to permanent housing, because in order to get to permanent housing, you have to first cure your addiction and cure your mental illness. We've had addiction and mental health problems for thousands of years. We don't actually know how to cure these things. We know how to work with people and we know how to help them do better, but that's a very unrealistic expectation. And so, of course, many people don't make it, don't believe that that's their problem, don't want treatment, want housing. And what ends up happening is that the group of people who are remaining outside the system because they can't control their addiction or mental illness or don't believe that that's the main problem end up getting arrested, going to shelters, going to emergency rooms, and back on the street. The people that we see frequently who have not managed the system well. Now, this is a rather small group of people because, remarkably, many people who are homeless for a short time. Most of the people who are homeless, and this is true everywhere, are homeless for a couple of weeks to a month. They've had an economic crisis, some tragedy in the family, somebody got sick, and they stayed with relatives or went to a shelter and went back out. The group that we typically think of as the homeless are the people here, the bottom 15% or so, who are going in and out of these systems, because this group of people takes up 50% of the system resources, because they're coming back over and over again, repeating the use of acute care systems. And so not only is it ineffective, but it's very costly. So Housing First was something that started in the 90s, and we started it out of the frustration of working with a group of people that couldn't make it up the stairs. So for that group of people, we needed to have a different system, a different conversation about what is housing and what is service for them. And when we sat with the people that we were working with and talked about it together, what makes sense for you? You know, that was a new way of doing business. It was not, we know what to do and this is how you're going to do it. We weren't running an efficient program. We already knew the programs we had in place were not working. So we were prepared to try something new. And part of trying something new is not only the design of the program, but it's also how we designed it. We designed it by including the people we were working with in the conversation as part of that design, part of the being architects in their own life. As our friend earlier this morning was saying, you know, people have dreams and people have goals, people have their own wishes. And so you want to create a program that allows for input from people that are going to be participating in the program. Not surprisingly, people told us exactly what they wanted, which was like what we would all want if we are homeless, a place to live, a secure, safe place, not a place that was, you know, in any of the accommodations we saw this morning, and there are many of them. And it's actually very difficult to live in those places because they're crowded. You're basically learning to live in a very congested, you're learning to share, you're learning a lot of things, but you're not learning how to live independently in the community. You know, one of the complete errors in the planning and thinking about housing readiness or any program like that is that people will learn to live independently in the community only by having the opportunity to live independently in the community with some support. We cannot learn how to swim in this classroom. We have to get into the water. And it's the same thing. You can't figure out whether the person's going to be a good neighbor or not a good neighbor or how they will behave in an apartment unless you put them in an apartment. But so we didn't require. I mean, some of the things that you had to do this is what you had to let go. A lot of old beliefs and prejudices about what it means to have an addiction or what it means to have a mental illness. That you were willing to take a chance that someone knew themselves well enough to ask for help when they needed it and can certainly manage an apartment. Well, people explained, if I can manage life on the street, I can certainly manage an apartment. So it's not just a housing. It's not about the housing. It's not about the housing. It's about the people and working with people in a collaborative way. It's about not being clinician-driven, but being client-driven. It's not about treatment first. It's about housing first, because that's what people want. It's about offering services to people on their own terms, where they live, in their homes or in their community, rather than expecting them to come to the office. It's about turning over the power to make decisions to the people that those decisions are going to affect. And it's about allowing them to decide what services, in what sequence, and how often. I mean, we call this thing housing first because it's catchy, it's simple, but it's way oversimplified. It's really about people first. And frankly, if somebody on the street said, hey, listen, I want to go to addiction treatment before I go to a house, no problem. It's not our decision about the sequence of the program. People choose housing most of the time, like 80-90% of the time. Someone who's homeless wants housing first. That's why it's sort of called that name, but really it's about what people want first. So this kind of conversation about, is it this program or that program, I think we just want to take a little step back and say that in order for us to come up with a design that makes sense in this context about whether it's homelessness or working with people who are refugees or asylum seekers, I think the idea that we should start with, rather than figure out should it be this kind of housing or that kind of housing, is that a larger question about where do these people fit in our community? What is our community's vision about the place of refugees? And have that conversation in the most inclusive way with policymakers, program planners, and people who are refugees or people who are asylum seekers, so that we have a shared vision of what it is that we're trying to accomplish, rather than one group of people trying to prescribe for another what it is that they need to do. When you do things that way, and I think this is why this Housing First program has really been implemented, all over the States and Canada and Europe, is that the program is not about the specifics of how we do things. It's more about the principles that govern the program. Because you want to stay at the level of principles, because the way one community does something may be a little bit different depending on their resources than another. So the main principles of the program, this is for people who are homeless and have a mental illness, remember, was that people need to have a choice about where they live and what services they get. Client choice is the foundation of Housing First. There needs to be a match of services with the needs of the people. Most of the people we house are not, require some level of assistance, and so we have to figure out what's the best way to help them. We want to make it about serving people, not about the housing. People don't go into one type of housing and stay there. Their housing needs change all the time. They have a kid, or they get into a relationship, or they're reunited with family. They want to move closer to their job, just like the rest of us. It's not like, oh, here now you have a place, that's the end of the story. It's like you have housing, I'm here to help you, and I'm going to help you whether you need to change your housing to another place or not. So you don't break off the relationship because the housing is solved. It's about the relationship. Recovery-oriented services, that's really more for the clinical services. And social inclusion and community integration, I think, is a fundamental issue. I mean, you know, just like we saw in the first speaker's presentation, this idea of the camps and congregate housing has a long history. And of course, it has a very long history also for people with mental illness. They have been in institutions for a very long time. We are now saying that people want to live in the community like everybody else in their own apartment. That's a radically different approach to working with people with severe mental illness than they had before. But that's the goal, and that's what people want, and that's sort of the shared vision of what the program is about. So it looks like then it's housing like everybody else, also on their own terms. People don't have to meet conditions or housing readiness. They have their own lease and their own rights. This is not only lease rights, but it's also housing as a basic right. And when you think about a cultural application of that very fundamental principle about housing as a human right, that takes you away quickly from what do people need to do to deserve housing. Everybody who is not securely housed deserves housing, and we as a culture believe housing is a human right, and we provide that. The rent is affordable, the furnished, these are some of the descriptions of how the services and the housing is offered. It's not just housing, it's also about improving quality of life. So there are job support, educational support, services. So the person making home visits, after the person is housed, there are home visits that allow for all kinds of services to be provided in the home and in the community. The definition of service, because typically we work with social workers or nurses, has to be expanded. It could be also helping the person to program their VCR or to fix the screen door or how to call a plumber. You know, it's like service in like most general sense of helping people. If somebody loses their housing for whatever reason, they maybe lose their job or their benefits, we will stay with the person and find them another house. Remember, it's not about the housing, it's about the person, and we will follow that person wherever they need to go. People do graduate out of the program, which is they don't any longer need the service support, but they may need some help with the rent. But in that way, there's a separation of services and housing. So if you do things the stairway model, and if you do things this way, you don't have to take my word for it that one way is better or more effective than another. There's a lot of evidence now, and I'll just tell you about one study that was completed in Canada, 2014, okay? This was a study of housing first in 5 Canadian cities because the government was interested in getting people off the streets. They invested $110 million in this study, and it was a study that included about 2,250 people. All of this information is on the Mental Health Commission of Canada website. Mental Health Commission of Canada website. What they found in these cities, Vancouver, Winnipeg, Toronto, Montreal, and Moncton, it was a randomized control trial, which means these 2,000 people, half of them were randomly assigned to housing first, and the other half were assigned to the stairway model. And then they followed people for 2 years. And these are the results of housing stability over 2 years. The stairway model here, after 2 years, about 40% of the people were housed. And in Housing First, people got housed within the first 6 months and then stayed housed. So it's not just about persuasion, it's a lot about the data. And they also found that if you do it this way, you save a lot of money. You don't have to pay for shelter, transitional housing, and all of these expensive congregate services. It's actually much cheaper to put someone in an apartment with supports and much more effective than it is to go the stairway model. So some of places that have been using this in reducing homelessness, lessons learned. Well, I think I've already covered most of these. I'm just, I think, reiterating that that you appreciate that people are much more capable than we imagined. I think a lot of this is based on people need to learn skills when they already have them. And I think that including people in the planning is a key piece of it. And I think a shared community vision. And I'll leave you with this community vision. Is from Frederick Weissman's new film called Jackson Heights, Queens. I don't know if any of you have seen it. You know, it wasn't widely, but this guy's a documentary filmmaker, Frederick Weissman. He's done stuff on mental illness, on experimentation. This one is about this one neighborhood where there's, in Jamaica, Queens, it's about, about 100 square blocks. And in this neighborhood, there are 135 languages that are spoken. 135 languages in this little area of Queens. And the people sitting here, these men sitting here it's a driving test they're taking to be taxi drivers, are from countries all over the world that are probably at war with each other. But they're in this classroom and they're living in this community and they're, have a common goal of making things better for themselves and for their families. So it's not about human capacity. We have the human capacity. It's the politics and structures we put in the way that prevent us from having that kind of a community. Thank you.
Thank you very much. We now got some time for a few questions. Fragen können natürlich gerne auch immer auf Deutsch gestellt werden. Wir haben ja kompetente Übersetzung hier. Also bitte nicht irgendwie...
Yeah. I'll be ready.
Can I ask it in English? As you said, the housing costs have been going up very much in the United States. Most people cannot afford. How do you provide the housing? How do you find affordable housing for the people that you provide services to?
How do you find affordable housing is not easy, but remember we're looking at, in the United States, chronically homeless people. We're not looking at affordable housing for everybody who's poor, because then I think we would be in trouble, because there isn't enough affordable housing for everybody who's poor. But for that small group, the 10 or 15% of the homeless who are going in and out of all these systems, there is enough housing for them. It's like there is affordable housing, but very limited amount. So if your goal is to get people off the streets, you can achieve that. If your goal is to address poverty reduction, having people have their own place, nobody's making that conversation, not in the United States. They are talking about poverty reduction in Canada. But I think ultimately all of this about the affordable housing, it's not just limited to the States, it's the same also in Europe.
You're at Columbia University, and some of the highest real estate prices and rents are around Columbia University. So
Columbia University is creating the problem.
Yes, I know. So where do you put people? Do you put them in Queens? Do you put them
That's right. You know what? I've been doing this for a long time. So I can tell you, I used to be able to find apartments in West 50th Street in Manhattan. But now that became like Clinton, it got a real estate name, so now I can't afford that. Then I was finding apartments in Harlem. But now Harlem is having renaissance. So now you have to go to the South Bronx. So there is,
As a follow-up question, do you have a net of service providers that are scattered all over New York now?
Well, the service has always been, we visit people. And so, because we don't have really, we're not an institution, so if the people you're serving are in this community, then your team will find an office in that community so they can visit people. It's very portable. So you make small neighborhoods wherever you go.
Ja, also meine Frage geht jetzt speziell um den Transfer von dem Thema. Oh, sorry, yeah, maybe.
Talking,
You
German,
can,
right?
I can also say it in English. I don't care. Okay, jetzt haben Sie es aufgesetzt. Okay.
German or
Ich spreche jetzt einfach auf Deutsch weiter. Okay, dann setzen
Are you
Sie
going to
es
speak
auf.
in German?
Ich denke, es ist besser, wenn ich es auf Deutsch sage, weil ich weiß manche Worte nicht auf Englisch. Meine Frage ist jetzt, wenn man jetzt speziell die Zielgruppe, ich sage jetzt mal Wohnungslose, Obdachlose, jetzt vergleicht mit der Zielgruppe geflüchtete Personen, dann kommt man ja auf gewisse Ähnlichkeiten, aber natürlich auch auf gewisse Unterschiede. Also angenommen, man würde jetzt dieses Housing First, Programm oder Paradigma direkt übertragen auf Geflüchtete und deren Problematiken. Dann ist ja eine Ähnlichkeit, dass auch Geflüchtete eine Punktprävalenz bei psychischen Störungen haben, die deutlich über dem Durchschnitt von anderen Bürgern liegt, sozusagen. Also speziell jetzt was posttraumatische Belastungsstörungen anbetrifft, aber natürlich auch Komorbiditäten wie Depressionen, auch natürlich Suchtproblematiken, die dadurch auftauchen und aus verschiedenen anderen Gründen quasi mit Komorbide sind. Wäre ja jetzt quasi die Übertragung zu sagen, okay, wenn Housing First auch für Geflüchtete gedacht ist, müsste sowas wie eine Art ambulant betreutes Wohnen in der Flüchtlingssozialarbeit folgen für Geflüchtete. Was wäre denn Ihre wissenschaftlich-empirische Meinung, was dann ein guter Betreuungsschlüssel wäre? Speziell jetzt, sind wir mal ehrlich, ne? Also speziell jetzt, wenn Sie sagen quasi Klienten-Choice ist das, was das Wichtigste ist, wenn der Geflüchtete das machen würde oder machen wollen würde mit Unterstützung. Nicht jeder braucht die Unterstützung, das ist mir durchaus absolut bewusst. Aber nun gerade die Personen, die sagen, okay, ich würde mir gerne Unterstützung wünschen beim Integrationsprozess, was sicherlich ja auch einige sein werden, weil Nachfragen ja auch von Geflüchteten kommen an hauptamtliche Unterstützer. Was wäre denn ein Betreuungsschlüssel, der sinnvoll wäre?
Thank you. That's a great question. I think. Is there more? I think that the application from your question would be what we've learned from providing housing first to families. People need help in securing a unit. They don't have references, they don't have a history, they don't have money. So the agency role in securing flats is important. And I agree with you that people will need services, and as we get to know them, we know exactly what kind of services they need. Some people will need intensive, and others less so. And the services will look different because these are not individuals with severe mental illness or addiction, but they do have trauma. They have issues about job finding after they're housed. They have, if they have kids, school systems and how to navigate that. So there is a need for support services with the housing. I think what you would have to do, like the principle is you house people with no readiness, and then you match the services that you provide to the needs that they have. So it's very much, as you get to learn them, you're prepared to offer them the right service mix. So did I answer your question? Okay.
Darf ich nur was hinzufügen? Darf ich nur kurz hinzufügen? Weil von wem kam die Frage? Das wird heute am Nachmittag im Workshop detaillierter behandelt, wo ich ein Projekt präsentiere, was wir in Wien machen, eben Housing First für asylberechtigte Familien. Und da haben wir einen Betreuungsschlüssel von ein Vollzeit-Mitarbeiter oder Mitarbeiterin betreut 10 Familien. Konkrete Antwort.
Thank you. It's a good plug for our workshop.
Ich würde gerne auch meine Frage auf Deutsch stellen.
Okay.
Sie hatten zu Recht betont, dass die Obdachlosen über vielfältige Skills verfügen aufgrund ihres Lebens auf der Straße. Mich würde interessieren, ob daraus in den Housing First Projekten auch Selbstbauprojekte entstanden sind oder in den Studien erfasst worden sind, wo tatsächlich Low-Cost-Bauweisen mit den Obdachlosen zusammen ausprobiert wurden.
No structure? Low cost. Oh, as a job, you mean? Yeah. Yeah. No, I think that employment is typically the second thing people ask for. First, housing first. What's second? Usually employment. And so there is, and we use a model called IPS, Individual Place and Support, or Supported Employment it's called. And it is a model where you work with the employer, and so you're brokering jobs, right? So just like you go to a landlord and ask for an apartment on behalf of the person, you go to the employer and you say, I have people that are interested to work, and I will help them with that. And if you have an issue, you can tell me, I can find someone else if they don't show up. So it brokers the employment piece. But that's, in preparing for a program like this, I mean, that would be the way to prepare best. That people are going to ask, when you say what's next, it's going to be that. Healthcare also is up there. Yes.
Thank you very much.
This person
we have
has
one
a
more question. Okay.
We have to take her question because she helped me put the slides together.
Thank you. I'm wondering actually how is the organizational structure of Pathways National or these housing programs? Who are financing it? Who are engaged? The supporters,
Right.
institutions, and
Right.
how it would be possible to translate it to the German issue now,
Right.
without government will, for example.
Yeah. That's a great question, and I think there's something very complex in this issue, because if you are working in the United States, the government is doing nothing or almost nothing. So the NGOs are doing the government work, right? But in a way more flexible, because you are getting, the Pathways to Housing programs are all government funded, like 95%, for rent and for services. There is a flexibility in how you provide the program. We don't have social housing, for example, in the United States. Here, you have social housing. So it's like a two-class, in a way, system of housing. And so the government said, well, I'm already paying for housing. I have social housing, but there aren't enough units, and you have years of a waiting list. So in order to translate this here, for example, in the Netherlands, the social housing providers had to agree that every year they had a few thousand empty units, right, because they have lots of social housing. And they had to agree that people who were targeted by a Housing First program as being very needy from the streets would get a priority placement and jump over the waiting list. So, you have to use the principle and then figure out locally how to make it work.